everybody, my name is Chris Raines. I'm a perinatal psychiatric nurse practitioner, and I wanted to talk to you today a little bit about sleep. When you're pregnant and postpartum, sleep is probably the most important thing you can do for yourself. I often call it the most important medicine. Without sleep, nothing else works. What we want to do is we want to have a goal of 6 hours of continuous sleep. So one of the things that I think is really helpful and what I talk to patients about is really splitting the night into 2 6-hour shifts, starting maybe at 7 and going till 1, looking at that and determining what shift each one of you want to take. When it's your 6 hours off, then you go into a quiet room, if you can do that, or you go into a space in your house that is away from the baby. You can use headphones, you can use a sound machine, you can do whatever you need to do to be able to sleep without hearing the baby. The room should be dark, it should be a little bit cool, because that's what's going to help you sleep. If you are 2 weeks postpartum and you are nursing, it's important that you be able to nurse every time the baby wants to eat. So one of the things that I recommend is that while you're sleeping, if it's time for the baby to eat, then your support person or partner brings the baby into you, lets you nurse on both sides, and then your partner takes the baby out. So what that means is that you're not doing the diapering, you're not doing the soothing or the rocking and putting back to bed. When it's your 6 hours to be on, then your partner or your support person gets to come into the room that's a quiet, dark room, and you take over. It's not going to work all the time, and you're not going to be able to get 6 hours of sleep all the time. But what it does is it helps you set up a plan that gives you a system of being able to get as much sleep as you can. We talked a little bit about sleeping when the baby sleeps. That's hard sometimes, right? Because you're laying there, you can't go to sleep. Most of us can't go to sleep during the day. And then you lay down and you're thinking about all the things that need to be done. Your mind's going 600 miles an hour and you're saying, I got to do the dishes. I need to wash bottles. I need to do a laundry. What's important for you is to let those things go and to lay in your bed or lay on the couch, even if you don't sleep, being able to rest and let your body rest is almost as important as getting sleep. What can be really hard if you're a single mom? What are you supposed to do? How are you supposed to sleep? One of the things that you can look at doing is using maybe a postpartum doula or a night nurse. And what that might do is give you a block of time. They may come for 4 hours or 5 hours and give you a block of time to really kind of be off. So don't think that there's not support out there for you. You're not alone. Sleep deprivation is a normal part of the transition. So it's not like we're going to take away all of your sleep deprivation. What we want to do is prioritize your sleep and know that by getting enough sleep or by getting almost enough sleep, it's going to help you be a much better parent. Give yourself some grace and do the very best that you can. And if you can't, and if there's things that need to happen, then reach out for help. It doesn't mean that you are weak. It doesn't mean that you're not a good mother. What it means is that you are a good mother and you recognize that these are the things that you need to do to maintain your health and your mental status so that you can be the best mother that you can be for your child. Here are some things to remember about the importance of sleep.